My name is Chinwe Anuforo. I'm a psychiatric mental health nurse practitioner, board certified, and a DNP student with Maryville University. First, I want to acknowledge my God, my Savior, for blessing me with a grace of endurance and resilience. My heart is thankful to my chair, Dr. Carol Berger, for all her support and encouragement from day one till present. Dr. Wunderlich, Dr. Tuba, my committee member, Dr. Frank Anekwe, my spiritual mentor, and my son Kyle and siblings for hanging in with me. Today, I will be discussing with you my research project on nutritional coaching protocol to improve blood sugar levels in adults with type 2 diabetes. This project was chosen because it is a serious medical condition and can be lifelong. Introduction. The Center for Disease Control and Prevention data indicates that more than 34 million Americans have type 2 diabetes, according to CDC 2021. This chronic disease affects 1 in 10 Americans. Individuals with type 2 diabetes have a high level of hemoglobin A1C level of 6.5% or more, according to CDC 2021. Empowering patients is key to health management among patients with type 2 diabetes. This scholarly project aims to evaluate the efficacy of introducing a diabetic coaching protocol involving nutrition, My Plate app, to reduce hemoglobin A1C in type 2 diabetic patients. The project seeks to highlight the techniques and benefits of health and wellness coaching in enhancing patients' efficacy of diabetic self-management. This project intends to complete a comprehensive discussion to incorporate healthy diets to improve or normalize hemoglobin A1C levels in patients with type 2 diabetes and educate patients on the My Plate app on CDC website to enable them to monitor their progress and encourage self-management. The project was guided by a PICOT question. Does implementing a nutritional coaching program in type 2 diabetic patients result in lower hemoglobin A1C levels and weight loss as opposed to no coaching program? Introduction continued on the next slide. Type 2 diabetes is among the most common chronic illnesses among adults above 45, but it can also affect children, teens, and young adults. Patients with the disease may experience 2 interrelated issues that adversely affect their quality of life, according to Cairo and colleague 2020. The patient's pancreas fails to produce enough insulin, and their cells respond poorly to insulin, leading to a high level of hemoglobin A1C. The scholarly project will expand nurses' knowledge of non-pharmacological treatments required to reduce hemoglobin A1C levels in type 2 diabetic patients. The project will also help patients achieve self-management by learning to maintain healthy eating habits. Introduction continued on the next slide. The chosen site, a diabetic management center, significantly supported the scholarly project. The site has different stakeholders, including patients, a comprehensive healthcare team with primary and allied professionals who were willing to participate in this health promotion plan. The main stakeholders involved in diabetic care include the providers, diabetic nurse specialists, registered nurses, registered dietitians, and the clinic manager. These stakeholders were also involved due to their active roles in caring for diabetic patients at the selected site. The stakeholders participated in the study by observing and recording appropriate information. I collected relevant information about the non-pharmacological methods in diabetes management from health record retrospectively. Integrated review of literature. A comprehensive literature search about interventions for reducing and normalizing hemoglobin A1C in type 2 diabetic patients was conducted. The databases searched include the Cumulative Index of Nursing and Allied Health Literature, PubMed, Google Scholar, Cochrane Library, Medline, Scopus, ERIC, and Embase. Examples of key terms used include glycated hemoglobin A1C control, non-pharmacological intervention for type 2 diabetes, health coaching in type 2 diabetic patients, intervention for reducing and normalizing hemoglobin A1C, and health coaching programs for reducing and normalizing hemoglobin A1C. The review was limited to evidence-based peer-reviewed primary articles published in English within the last 5 to 7 years. A total of 25 primary studies, predominantly randomized controlled trials, were chosen and integrated in this literature review. 3 themes emerge from the literature. The first one is non-pharmacological therapies. For example, nutritional therapies, exercise therapies. The second one is health coaching. A study by Long and colleague 2019 examined on the effectiveness of health coaching. Health coaching has been described in literature as methodical technique that assists patients to realize knowledge, self-reliance, tools, and proficiency to actively engage themselves in self-care and achieve self-recognized health objectives, according to Long and colleague 2019. Another study by Singh and colleague 2019 focused on health coaching. Singh and colleague 2019 added that an optimal health coaching program should be oriented on 3 major fields encompassing environmental and emotional wellness. A study by Marquette and colleague 2021 focused on telehealth to support health coaching. According to study by Marquette and colleague 2021, health coaching leads to medically pertinent advancements in various biomarker risk factors, such as waist circumference, body mass index, body weight, hemoglobin A1C levels, fasting glucose, cardiorespiratory fitness, and total cholesterol. The last one is self-management. For example, mobile app, accessible mobile application on CDC website. The key components of health coaching are the adoption of self-discovery procedures, patient objective, consistent coaching, patient-centeredness, accountability. The next slide, I will discuss the strength, weakness, and gaps. The primary strength of these sources is that they mainly focus on intervention in primary setting. One common weakness is that majority of the studies relied on face-to-face coaching. It suggests that potential respondents that were unable to engage in physical coaching were not included in the project. The gap in the studies relates to the use of the MyPlate app to manage type 2 diabetes. No study used MyPlate app as the primary intervention. The current study addressed this gap by examining the effectiveness of using the MyPlate app as a nutritional coaching protocol to help patients regulate their hemoglobin A1C levels and weight. The framework guiding the project is the health belief model. Intervention. MyPlate app nutritional protocol was executed. A registered dietitian met with the patients and formulated a personalized meal plan intended to help them control their hemoglobin A1C levels and body weight. Patients were trained on MyPlate app on how to track their eating habits and weight. This included identifying various healthy foods that should be consumed regularly. Patients were able to monitor their dietary eating habits on a daily basis. The participants recorded their weights to determine if there are any considerable changes. Methodology. The quantitative exploratory design through a retrospective chart review was utilized to facilitate informed conclusion throughout the project. The scholarly project was conducted at a chosen healthcare clinic in the western region of the United States. The selected site is a diabetic management center appropriate for the planned project. The data for the study was obtained from electronic medical records. The project targeted type 2 diabetic patients 18 to 70 years of age, and all genders were included as participants. 50 records were utilized to compare hemoglobin A1C and weight pre and post implementation of the nutritional protocol. The data was analyzed using SPSS statistical software to establish multiple correlations among the variables. Demographics. The histogram demonstrates the age characteristics of type 2 diabetic patients engaged in the project. Based on this figure, most of the subjects were aged between 31 to 55 years, suggesting that middle-aged individuals comprised a larger portion of the respondents. From the sample, 19 subjects were male, 31 subjects were female. This trend can be supported by the fact that women normally have higher sex hormone binding globulin levels than men. Sex hormone binding globulin has been identified as a vital genetic element impacting the pathophysiology of type 2 diabetes according to Otadotia and colleague 2020. The mean age was 39.9 with a standard deviation of 1.7. This is an indication that the age range was relatively spread out. Demographics continued. A pie chart was used to represent the demographic features of the subject to provide a clear picture of their composition. The pie chart shows that African Americans were the dominant group, accounting for 38% of the respondents. The second largest ethnic group was Hispanics, who accounted for 32% of the subjects. The third largest group was Caucasians, who accounted for 16% of respondents. Finally, the participants from other ethnic communities represented 14% of the respondents. Result. A Z-score analysis was conducted to run the data set to provide a robust framework for comparing pre and post data for hemoglobin A1C. The hemoglobin A1C scoring was done by following levels, with level 1 and level 2 being in the target range, as you can see in this table. During the pre-implementation, 13 out of 50 patients were at target range or considered controlled, while 47 out of 50 patients were at target range or considered controlled during post-implementation. The value of Z is 6.9402. The value of P is less than 0.00001. The project results are significant at P less than 0.05. In my next slide, this figure represents how many patients fell into various categories during pre and post implementation. Pre-implementation is marked in blue, as you can see. Most patients were out of target range between being above 6.6, whereas post-implementation, which is marked in red, as you can see, mostly everyone were at 6.5 or better. Weight. The results on the weight. To analyze the weight, a Wilcoxon rank sign test, a non-parametric test, was used to analyze the weight. The outcomes showed that the sample population of n equals to 50 showed a considerable difference in weight between pre-intervention. N equals to 50, M equals to 188.40, standard deviation equals to 1.06. Post-intervention, N equals to 50, M equals to 171.10, standard deviation 1.99. The variation in mean weight between pre and post-intervention was 11. This shows the intervention was effective in helping patients reduce their body weight. The finding is considered significant at p less than 0.05. My next slide, I'm going to discuss on the strength. Ethnic diversity was achieved in this project, making the outcomes more generalizable. The participants comprises individuals from different racial groups, including African Americans, Hispanics, Caucasians. Another strength is that the outcomes were similar to those of the study conducted earlier, confirming that nutritional coaching protocols using a self-management app led to positive outcomes. The intervention enabled patients to learn self-management skills, which are essential in efficient management of type 2 diabetes. Weakness. The study failed to take into account other diabetic management measures, such as medication, which may influence the outcome. At the same time, some patients may also be engaging in physical activities on a regular basis. Taking such measures into account is crucial in increasing the accuracy of the outcomes. My next slide is on discussion. The project outcomes illustrated that nutritional coaching protocol was efficient in helping patients reduce their hemoglobin A1C levels and weight. Specifically, hemoglobin levels went from 26% in the target range, less than 6.5 pre-implementation, to 94% in the target range, less than 6.5 post-implementation, which is a significant outcome indicating the project was successful. Patient lost an average of 11 pounds, which is also significant findings. Using my plate app nutritional protocol can help type 2 diabetic patients maintain healthy lifestyles by being able to control their hemoglobin levels and maintain the recommended body weight. Recommendation. The implications of the project is that nurses should emphasize the need to maintain healthy eating patterns when dealing with the target population. The nurses should educate patients on various ways they can be able to maintain healthy dietary habits. For example, nurses can educate type 2 diabetic patients about nutritional apps such as My Plate app to help them monitor their meals and weight. Future researchers should be more comprehensive and account for other variables that can impact the outcomes and use research designs that allows direct contact with the patient. The scholarly project demonstrated that nutritional coaching is beneficial in helping individuals with diabetes enhance their hemoglobin A1C levels and reduce their body weight. Healthcare facilities should consider integrating the nutritional protocol as a practice policy when caring for individuals with diabetes. Nurses should be educated about nutritional coaching to allow them to provide comprehensive patient education on the topic. These are my references. Thank you for listening.